Oh, hi to my YouTube subscribers. Before we get started today, I wanted to express my sincere condolences to all the families who were affected by the recent tragedy in Thailand. A deranged man with a gun shot a large number of children and adults at a daycare center in Thailand. This is something that happens too often in the U.S., but I don't recall this ever happening before in Thailand. I certainly hope it doesn't happen again. So in today's video, I'm going to tell you about a surgery that I had yesterday. So I had a surgery known as trigger finger release surgery. Trigger finger is when you close your hand and one or more of your fingers get stuck in the closed position. This happens because the tendon in each finger runs through a sheath, and that sheath, over time, can become irritated, inflamed, and constricted. Now, one way to relieve this is through a cortisone injection. The injection tends to reduce that inflammation and allow the tendon to once again move smoothly through the sheath. But in some number of cases, cortisone is not effective in reducing this inflammation, and you have to actually cut open the sheath and allow the tendon to move freely. The spot where this often happens is known as the A1 pulley, and there's an A1 pulley at the base of each of the fingers. So the procedure that I had was pretty straightforward. I had this done in 3 fingers, and the surgeon made a small incision, about 1 centimeter, at the site of the A1 pulley in each finger. He opened up the sheath in those places, and he manipulates the tendon to make sure that the tendon is pulling smoothly through the sheath. It's pretty interesting to actually see your finger move by the surgeon pulling on the tendon. This was done in the doctor's office. The doctor injected quite a bit of local anesthetic in the hand. When the surgeon was done, he stitched up these incisions. A dressing was put on, and that dressing stays on overnight. I took it off this morning. I took a shower, and I put a new dressing on it. This is not a particularly painful procedure. I've had hip replacements, rotator cuff surgery, spinal fusion in the past. All were very successful, by the way. And this is nowhere near as painful as something like that. I would say this is much more like a visit to the dentist, maybe for an extraction or getting a dental implant. It's borderline whether you actually need pain meds for it. And today, it actually feels fine. I'm feeling pressure in this area, but not anything that's really bothering me. So if you're scheduled for the surgery, this is not something to really worry about. So how did I come to do this surgery? For about 1.5 years, I had some pain along the side of my hand, but about 3 months ago, I developed more symptoms. I had very sharp pain right on the edge of my hand underneath the pinky finger. I had irritation right here, which is the site of the A1 pulley for the pinky finger, and my ring finger and middle finger were triggering. That is, they wouldn't open up by themselves. I also had generalized pain in this half of the hand on the pinky side. So I saw a doctor in Bangkok. He gave me a couple of cortisone injections, actually here and here. That actually had no effect. I saw another doctor in Phuket, and she gave me injections at the A1 pulley for the ring and middle fingers, and an injection on the back of the hand at the pinky. That also actually didn't do anything. I decided since I would probably need surgery, I'd go back to the U.S. where the surgery would be free for me. So I went to the doctor in the U.S. He wanted to give me another cortisone injection, this time in the site of the A1 pulley on the pinky finger. That injection had some mild improvement after the 4th day, but a day later reverted back to what it was before. The surgeon who did that injection wanted to wait longer before doing surgery. I didn't want to wait longer. I had another surgeon recommended to me. I visited him, explained the story. He said that I was certainly a candidate for the surgery in those 3 fingers. So I said, yeah, let's do it. You want to do it now? And he said, yeah, we can do it now. So we just did it in the office. I was able to drive home afterwards, no problem. I'm going to return to have him examine the hand in 2 weeks. I'm quite sure that the trigger finger symptoms will have disappeared, but I'll consider this a success if the pain that I was experiencing in the side of my hand goes away. At the moment, I'm not feeling it, but I'm going to wait the 2 weeks and see if that pain really goes away. If that pain is gone, the surgeon tells me there's no problem in me traveling back to Thailand right away. Now here's the place in the video where I plug my novel, The Vientiane Affair. There's espionage, history, politics, love, sex, violence, and great characters. I think you'll enjoy the story. And if you're an Audible subscriber, why not use a credit to listen to it? This is a way that you can support independent authors like me. Now, there is something we should talk about here. I've had a lot of experience with these surgeries, and what I find is that with all of these surgeries, there's always some more non-invasive version of the surgery. For example, when I had my hips replaced, the first hip was replaced by the traditional posterior method. My second hip was replaced with the anterior method, which is less invasive. My experience there is that you are much better off going along with the non-invasive procedure. Everybody who I know who has the posterior procedure done has problems. So if you're getting a hip replacement, go anterior. But the important thing is you want to go to a surgeon who does both. So if they tell you, no, you should do the posterior, it's not because they don't know how to do the anterior. Well, it's the same with this trigger finger release surgery. If you go on YouTube, you'll see there are a lot of doctors who advertise a non-invasive procedure that involves, instead of making a 1 centimeter incision, you make a very small incision and insert a stiff needle. So the doctor puts that stiff needle through the sheath in which your tendon rides, and the needle is manipulated until the tendon can ride freely through the sheath. Some doctors perform this procedure under ultrasound guidance, which helps avoid nerves. Now, the doctor who ended up doing my trigger finger release yesterday, he can do both methods. But he felt that in my case, it was better to do the traditional open surgery because I wasn't having trigger finger symptoms in my pinky. I was having pain at the site of the A1 pulley. When you do the non-invasive form of the surgery, you want to be able to determine whether you've released the trigger finger. And with the non-invasive surgery, that only works if you had trigger finger symptoms in that finger. In the traditional surgery, you verify that the tendon is moving through the sheath by manipulating the tendon. So in my case, the doctor recommended doing the open surgery. So if you're doing trigger finger surgery, there's a good chance you're going to be making this decision. I wouldn't recommend one technique over the other, but I would definitely go with a surgeon who knows how to do both techniques and can give you an objective answer on which is best for you to do. And that's true in general for these procedures. Best to find somebody who does both the traditional procedure and the non-invasive procedure. So you know that if he or she recommends the traditional procedure, it's not because they don't know how to do the new procedure. Just some advice. Okay, so I'm going to come back in 2 weeks and I'll tell you how it worked, and hopefully I'll be able to fly back to Thailand soon. So thanks for watching. I hope you found this video valuable. If you did, consider buying one of my books. You can find links to order the books in the description. So stay well. See you again soon.